Well, hello everyone and welcome to today's Spotlight session. I'm Mick Clayton from Mary Carer Services. I'm the team leader for community engagement and program development, and I'm filling in for our colleague Nick, who's not well today, and have very big shoes for me to fill. Today we're joined by two very special guests, Christine Scott, who is the Quality and Events Manager from Valid, who are a wonderful organisation who have been at the forefront of, I think it's fair to say, Christine, fighting for people with disability and their opportunity to participate in our community in a fair and high quality way for a very large number of years. And I'm also joined by Cathy Burneski, another veteran of the carer space, who is a wonderful advocate for carers, who is the carer support worker at Banyule Community Health, who's going to talk about their program today. So I would also just like to acknowledge the traditional owners of the land on which we meet today. I'm on the lands of the Wurundjeri people, and I'd like to pay my respects to their elders past, present and emerging. So the way today's session will work is Christine will tell us a little bit about Valid for 15, 20 minutes. If we have any opportunities for questions, we can ask Christine any of those at the end, and then we'll hand over to Cathy to tell us all about Banyule's carer support program as well. So without further ado, Christine, I'll throw over to you.
That's all right. And I will find my presentation. And I actually think, because I'm going to try to, unlike people who know me very well, I can talk forever. I am going to try to not take too long, because I can talk too long on things. So for those of you who don't know much about Valid, just a little bit of a quick overview, and I'm probably happy for short questions because we've only got a very small group here, to take them as I go. So what Valid, people always ask, what does the heck does it stand for? It stands for what you can see on the screen there. I don't know. Victorian Advocacy League for Individuals with Disability, if you want to know what those letters mean. And we are an advocacy agency, not a service provider. So we are independent of services. And for us, we see that as the best type of advocacy, because it's very hard to bite the hand that feeds you. So if you're an advocacy service funded by a big service provider, then are you really going to fight very hard for the rights of somebody? And I've seen advocates who have, and they've done a great job, but it hasn't been appreciated by the service that is paying them. And needless to say, they don't stay very long because there is a bit of retribution. So advocacy that's independent of service providers is the best, because it means that we stand separate. We work with service providers, but at the same time, what we do is seek to always make everything better, including ourselves, because all of us can improve. So, and our vision is really about making sure that people with disability get the chance to be equal citizens in the community and have the same, rights and opportunities as everybody else. Because obviously you can have a right, but if you don't get the opportunity, it's a different matter. You can't exercise that right. So for many years I lived in Bendigo, and you had the right to go to the post office, but you couldn't get in because there was, 30 steps in a heritage building. So, there are two different things. So we fight to try and I mean that in a way where we work with the system. And there are times where we'll go and placard, but it's the last straw. Or we'll do videos like our former CEO, Kevin Stone, did earlier in the year, when we were fighting the independent assessments for the NDIS. He did shame on you, NDIS. And we don't do that lightly. That was it was the final straw before legislation could easily have been put together and gone through if there wasn't a huge amount of opposition at that point. It was a crucial time. So we don't do it lightly. So we do, our main things that we do provide is that systemic advocacy that I just talked about there. I should have put this one first. So speaking up around issues that affect everybody with disability and their families, or most people with disabilities, such as NDIS and government policy. And if we can get that government policy changed for everyone, it's better than us banging our heads against the brick wall for every individual that's coming across that same problem. So if we can get the stop independent assessments that would have been very bad for people with significant disability, especially people with intellectual disability or a significant acquired brain injury or significant mental illness, then because they're not as likely to be able to advocate for themselves to an assessor and tell them all the things they can't do, you want to tell people what you can do. And so it would have been very bad. So we look to try and get that changed. And Jared, this is Jared actually speaking up at an employment forum. Jared's actually just resigned in the last year or so from Australia Post. He's a man with an intellectual disability and he worked for Australia Post for 20 years. He's a very passionate advocate for people with disability getting the opportunity to have a job. So we do a lot in that systemic advocacy. In other words, change the system to make it better for everyone. But then there are situations where individually people need support. And so we do individual advocacy, so advocate for an individual and or their family. And it's often families that come to us, or it can be a worker who's come to us and says, can I tell you this without giving you my name, or will you tell on me? And no, we don't tell on them. And so we're able to get things changed for people individually. We're one of many advocacy services. We do have a list of advocacy services on our website that if you just Google Valid, then advocacy services list, you'll get our list and you can download it. It has all of the advocacy services in Victoria because we're just one of many, but we are statewide and we are funded only to advocate. Our other programs are for anybody with disability, but our advocacy is only funded for adults with intellectual disability. Just as there are a few advocacy services who are funded for people only with physical disabilities or children, such as the Association for Children with Disability. When this funding was handed out in the 90s, we got the intellectual disability funding. And but just to understand what the difference with advocacy, we're not support coordinators, we're not there to help people long-term, assist them with organising their services and managing their services and organising assessments or the smaller problems. We're there for significant problems which you can't get resolved in your normal way, although lots of people ring us and if their problem is something that we know we won't be able to get to because we're, like most advocacy services, we're under siege with the number of people coming to us. Nearly every advocacy service has a 6 to 12 month waiting list in Victoria at the moment. So we tend to get to the crisis issues rather than the smaller issues. However, what we will do is refer people off to appropriate agencies that can assist them or give them short answers. So if they're saying, we're coming up to my review for the NDIS plan and I'm worried that I hear they're cutting money, which they are, then we can give them, we've got a review template that's free and available. It's a Word template and helps you prepare to get the things you need to get in order, evidence you need, so that you're prepared and at least you've got a list. A lot of people fail because they haven't even got a list when they go to the review meeting to run through and thought about it, let alone get any evidence. So we can give people those sorts of resources to assist them. And if they've got a support coordinator, we might have a chat with them to assist them with how to use the resource and also other things that we have that can assist them to support the person to put up a good case for what they need. If they don't have a support coordinator, they need to try and get one, which is very hard nowadays, but you can if you get a very good evidence for it. Other than that, I send them to you, lovely people, the carer support services, to get some help from their local service, and which is different in every area. So it's short term. So we might have someone who's being threatened to be thrown out of their group home. We might have people who their whole plan has been knocked back and they're in real crisis because they've got no money left in the previous plan, their NDIS plan. Or it might be that a carer has died and nobody has thought about the future. So there's lots of things we can assist with in that way. We also run, yes.
Sorry, I just have a quick question with regards to those resources you were talking about, that review list. Would that be something that's on your website? Or I'm just thinking about a couple of families that I've called up recently that are a little stressed about the review that's coming up.
Yep.
Is that something, because I know that you said you've got quite a long waiting list, is that something that they can kind of,
for advocacy, that's not like we're dealing with crisis, we're dealing with people's. So it's better to look, whilst our funding for family support went across to the NDIS, and then people are meant to buy our training or workshops via their NDIS plan. So we're not even able to provide them, although if they give, like I'm happy to provide you our tip sheets. Our tip sheets are on the website. However, I haven't had time to update them. But if you email me, I'll send you an updated, the review template. And they can do as little or as much on it. And that's what you're going to need to tell them. You need to say, you don't have to fill it all out and do the whole thing, but think about everything, and so that you're clear, and at least make yourself a list. Even if you don't have reports or letters or things like that, but once they think about it, but the key thing is get them doing it 4 months out from the end. Because they're ringing people 3 months out already, 2 to 3 months to book in the review. I don't think they've got as much to do now that they've palmed off so much to other people. I'm sorry, there's lots of wonderful people at the NDIS. I'm saying the system here. So, yes, start early and do what you can. A little bit is better than nothing. Even a list on an envelope is better than nothing. But yes, I can send you that. I'm happy for Nick and Mick, both of them. You got me confused with the two names then, to send my email along to you guys. I don't have a problem with that. I can send people stuff. Yeah.
Thank you so much. I know that would definitely help, even just give us a little bit of a tool to kind of help relieve some of that stress when we're talking with people.
Yes, so that's it's one of the most common things we have come into intake, for us, so happy to share any of those. Because of time, I will keep moving. Self-advocacy training, we support people with disabilities to learn to speak up. And that's not just rights, it's rights and responsibilities. Some self-advocacy is just about you're right, you're right, you're right, and hammer anybody. No, it's not about that. This is about healthy speaking up, building confidence, building up somebody's ability to speak up in their plan, because when you're not there as family or staff, who's going to speak up? And it's also protective behaviour, because if you've learned it's your right to be in the toilet by yourself, when someone tries to, in a public toilet, push in the public toilet door to get in, you push. No, I was told you're not supposed to come into the toilet with me. Or with my daughter, my daughter's Leah, my oldest daughter, she's 40. And, you know, when a worker was doing the wrong thing, she tells me. And I've taught her to speak up and be confident that it's her right to feel okay and safe. And if a worker makes her feel uncomfortable, then, or is talking to her in a way that she doesn't like, she should tell me. And when she was in the taxi when she was younger and there was a young fella with wandering hands, she told me. So if I had not taught her to speak up, now we do training for families on teaching basic self-advocacy skills to your family member, and we have lots of resources on that also around teaching people to speak up. And a lot of the day programs run our courses. We've run Train the Trainer with them. So sometimes it's good to tell people to ask their day service or their service, do you run self-advocacy? Because it's a really good thing, because who's going to advocate for them when you're not there? If they can, they should be able, you should try to build that capacity yourself if you can. Okay, and we also run peer groups in the community. This is some of our wonderful peer group members in a group shot. Oh, it's awful. The photo looked really good until I blew it up that big. Sorry, they're all a bit motley, but they are a really handsome and very talented bunch. And they're based in a lot of communities around Victoria. It's a project we're funded for by the federal government, and some groups have a mixture of families and people with disabilities. Some are all families or all people with disabilities. They learn and support each other, and they also take, this one is a group of people who took action about in Geelong and the Ballerine. You see the bollards there. All the bollards around Geelong, if you ever come to Geelong, you'll notice none of them have a disability. So they've advocated, they did their own bollards of people with disability to show the council, and now the council has worked with them to actually create bollards with disability to make the bollards program inclusive. So that was a wonderful thing that's brought people together, and also brought a lot of community agencies together as well. So the peer groups, though, are a great source of learning. They decide who they're going to have to come and talk to them. They decide what they're doing, what action they want to take, or whether they just want to learn stuff and have speakers, or whether it's hearing each other's stories. We have families training, although the funding for that went across to the NDIS. So people need to pay for it, like they have to pay for therapy out of their plans. They need to pay for this out of either self-management capacity building in core, or they can use the training for carers in 15 in the allied health area, improved daily living. We have all of those items on the invoice so they can choose. So, and we hate having to charge, but our funding was state funded, and our funding went across into the NDIS. So we've got no other choice, unfortunately. But we do run NDIS courses on learning how to use the rules against the NDIS and to get what you need in your plan. And we give them all the practical tips, because all our trainers are family members like me who have someone on the NDIS, and we're using the NDIS, and we read all the stuff for the service providers, let alone anything else. So we can give them family-based tips in a way that makes sense, because we use real examples for people. It's not a consultant telling people stuff or in jargon. We also run 2-hour workshops on any topic around the NDIS people want, whether it's how to self-manage or how to prepare for your next plan review is our most popular one. And we do those online, or we can do them in person if there is no COVID, but at the moment it's online. We do circles of support, so understanding circles of support, who's going, so building up a circle around the person, whether it's a circle at the employment service that they're working, or a circle in their local community, or whether it's a circle more broadly because you're of succession planning. We help them with all of that. So we also at the moment are running succession planning courses, which unfortunately are booked out until April. So there's only places left in May because they're very popular. But it's we've got funding through a Victorian Supporting Carers Locally grant. So we only had a limited number we could run. And we started them in August, and we got booked out to the end of the year within like 2 weeks. So so that they are there though, but people can purchase them through their plans. Okay. And look, if people have got quick questions, we're happy for them to email us too if they've got a quick question. Having Say conference, I just thought I'd just throw that in there because Having a Say is an amazing event. It's not a conference like any other conference. When it's not COVID, there's 500 to 600 people with disabilities, pet families, support workers. We have a big expo. We have a Red Faces competition. We have an art competition. We have sessions for families, and in fact, if people really want the succession, we've got some succession planning sessions at Having a Say conference. We've got one on wills and trusts, and all of those financial issues you need to think about. And if they say they're part of the succession planning training, they get in free. So I'll let them in free for families. We've got one on legal decision making by Villa Mantle. So they're going to talk about supportive attorneys, the new supportive attorneys and what they are, who can sign them, guardianship and administration, and supported decision making. So that legal decision making for when you're not around, what does it look like? We also got one on accommodation. So that was very successful that we held with talking about planning your future accommodation for when you're not around, because a lot of people haven't started anything and they can start right now. But the conference as a whole, we normally have 100 to about 130 to 140 speakers with disability at the conference. So most of the presenters and performers are people with disabilities, and our volunteers are often, this is Alicia, who's one of our volunteers. Alicia is part of the organising committee for the conference as well. And so it's an opportunity for people to build their skills from just being inspired by others to do something different, trying to come and try and then going home and doing something different. Or a lot of young people come with their family, their parents, the parents go to parent sessions, they go off to a session. We do have volunteers, and so if people need a buddy, we can give them a buddy for the day, as long as their needs aren't significant and you don't need huge training, obviously, for that. But otherwise, support staff, if they're bringing a support staff person, and it can be funded through their NDIS plan. This can be funded out of CORE for them to come to the conference, and it's in February next year. And so I've actually done so well I really have. I'm to the end now. So that's just if you've got any queries, my phone number and email. But happy for any quick questions, because I'm not sure how long, given we started late, I have.
Thank you so much, Christine. That was really, really interesting. And I know you guys just have a wonderful array of services. If one of our team members identifies a family who have a family member who could benefit from your services, what's the best way for our team to refer them through to you?
Oh, it's best if they come through to me. If they go through intake, they'll get the very disheartening email saying we've got a waiting list and please try these other places if it's not a crisis. If you just don't need that. It's better for them to come straight to me, because then I can give them a human response. And also I can give them some real ideas on it, because we have got a waiting list and we've got enough at the moment to do an NDIS course. So we will be running an NDIS course soon. And so, that's what we do. We keep people on a list, and then when we've got enough to run a course, we run one. So, but if people are urgent, we can give them some tips and some help, and that's no problem. We'll do that.
Okay, wonderful. And can I also just check my understanding on the advocacy side? You can support people with intellectual disability from anywhere in the state. Is that right?
Yes, all over Victoria, yes.
Wonderful. Has anyone else got any questions? Oh, sorry, go on, Christine.
Long as they're 17, 18, but ish and over, yeah. Although if their issue is a young person's issue, we might refer them to WIDAS, Youth Disability Advocacy Service. Yep. But if it's an issue that is with a disability service provider, that falls in our area of expertise, then we'll take it. Yep.
Awesome, thank you. Has anyone else got any questions for Christine? No? Well, thank you. If anyone does have any questions, please feel free to send them through to me and I can pass them on to Christine and follow up. Christine, thank you so much for making the time to talk to us today. I've really, really enjoyed hearing about what you're doing, and I know from my past life, all my interactions with Valid have been very positive, and I know you guys do wonderful, wonderful work. So thank you very much, and I really appreciate your time today. So next we introduce Cathy Burneski, who, as I mentioned before, is the carer support worker at Banyule Community Health. So thank you, Cathy. Tell us all about what you do.
Thank you, Mick. I'm wondering, did Nick send through the slides to you, and would you be able to present them? Is that okay? Yeah, if not, it's not an issue.
No, I've got them right here, but I must admit I didn't get them ready before we started talking.
No worries, no problem. That's fine. I'll wait. And I'll just say next slide. So
cool. All right, now let me do my share my screen thingy. Okay. Oh, hang on. How's that? Can everyone see that?
Perfect. Thank you, Mick. Thanks. Appreciate it. Thank you for the opportunity and for the time to meet some of your team members and to talk a little bit about our service at Banyule Community Health. Before I get into the role, I'll just briefly mention that, yes, I work at Banyule Community Health as a social worker with a carer support focus. We've got two centres, the one in Alamein Street in West Heidelberg, and we also operate from Grimshaw Street in Greensborough. My position is mainly located at West Heidelberg, but I am able to see clients in our Greensborough centre if that's needed. I'll just mention very briefly, I hope I don't forget anybody, and a list of other services that we offer at Banyule Community Health as well. We do have our legal service that operates from the West Heidelberg Centre there, which is a really valuable service for people to know within the community. And there are a series of areas and issues that they do cover. And it's well listed in our website there at Banyule Community Health. In regards to also, we offer the Adult Education Centre. We have financial counselling, there's emergency relief and generalist social workers who have short-term complex case management component. That's another service that we're finding at the moment has a bit of a high demand with, I guess, what's happening in the period of COVID and some complications that come out of that for our local community members. We do have a dental service at Banyule Community Health. Our more traditional children health services, the allied health team, which obviously consists of a physiotherapist, our occupational therapist, a dietitians, podiatry, speech therapy, the diabetes educator, and my role as carer support worker actually sits in with the allied health team. We have our medical services, our doctors and our nurses. We've got gambling support services, and our First Nations health services as well, our Aboriginal health team, which also offer counselling, casework and men's support to that community. We do have mental health services as well, which are our counselling, and they've got specific areas of specialty that they cover. Our LIFT, which is our stepped care model program, and also a Head to Help program as well. So that's just a little bit about the whole centre, and then I thought I'd hone down into where I fit in Banyule Community Health. So as the first slide, thank you, Mick, shows that I'm actually funded through the Commonwealth Home Support Program. I thought that might be just interesting to point out because I'm not funded through carer services streams. It's actually funded through the Commonwealth Home Support Program. I do have a little bit of funding, which is what we call the HAC funding, for those that are familiar with that concept, for the underage group of 65. So majority of my work falls into the group of caring for someone who is over the age of 65, but also I can get referrals for people of caring for any age group at this point in time. Next slide, Mick. Now, I know who I'm talking to, so I apologise about that first slide. I didn't adjust it specifically for this presentation, but we all know who carers are, and my definition is the definition that is obviously within the carer services as well, which is a carer is someone who provides care to a family member, friend who needs support, supervision and assistance with everyday living tasks. The reason why I say that is because, as we always know, defining who a carer is can sometimes be a bit subjective, and we've got to make it clear when our referrals come our way that when it's not about the paid carer, it's about the unpaid family member. You know, it can be anybody, it could be the neighbour, the family, friend, but they have to demonstrate that they are providing a significant support to that person who's got care needs. And without that carer really being in the picture of that person they're caring for, you know, the person might struggle a little bit to continue living at home, you know, as independently as possible. Next slide, Mick. So in terms of the eligibility for the service at Banyule Community Health, carer support, it is referrals through the My Aged Care Referral Pathway because it is a CHSP funded program. So those ones, and there is a pathway, and I can let people know what that pathway is to get that referral to our service. I can do that as an email afterwards. There's a few steps there. In regards to the person they're caring for, it is someone over the age of 65. So that's the majority of my referrals. They do come from regional assessment offices, the RASs, the aged care assessment services, because we're finding that when they're assessing the people that we call the care recipient, they're identifying a carer. And with their consent and with their assistance, they can refer them through that My Aged Care pathway if they are obviously known to My Aged Care. If they are not known to My Aged Care, there is a process there that our intake workers will help the person to register with My Aged Care to get through to being referred to our service. At the moment, as I said, we have in the last probably 6 months opened it up to all carers now. I should mention at the start that it is a part-time position, that it's not a full-time position, and there's no other, a carer team around me. I'm a sole position. Having said that, I work within the allied health team, and there's a lot of care coordination that can happen between clients we might have in common. For example, with the occupational therapist, we are known to do joint home visits and things like that. Next slide, Nick. So this is a question I get asked a lot, and even when I first started at Banyule Community Health not long ago, about 4 years ago, where I get asked, so what does carer support actually do? And I do get a lot of referrals from our internal services where, they've actually, for example, the podiatry team, as we know, they see regular clients on an ongoing basis over a period of time, and sometimes they share their stories around, what else is happening for them. And they may say, I'm looking after my partner who's got dementia. And the podiatry team, will say, well, how are you going? How are you coping? We've got a carer support worker. Would you be interested in talking to them? So those internal referrals then start to highlight, well, what actually do you provide to carers? So on the first off, I'll say I don't have brokerage. So there is no funding attached to the service there are carers who need to tap into brokerage services, and I'll talk a little bit about how I do that. But my focus is about the carer, as I know other carer services and yourselves there at Mary Health do in Carer Gateway, where we talk about their needs and identify what their current issues are at the point of the referral being made to the service. We focus on their health and well-being, and it's well reported and well studied about the impact that caring has on carers' health and well-being. So we start about what's happening for their overall health. And sometimes carers we hear don't attend to their own health issues, like they might not have made a GP appointment in the last 12 months. So I do focus with where the carer is at and what they're confronted with. There is an assessment process. We do develop what we call goal setting and care planning. So we're working towards a care plan that the carer identifies what they want to change, what they want to shift, what issues come up in that initial assessment, formulates into a care plan, and we work through that care plan with them. Provide emotional support. We make it very clear I'm not a trained counsellor, but if it comes up that through that process that they would benefit and are needing that counselling, we do look out and also internally about what type of counselling will benefit that carer. There's a lot of information sharing and sharing during my initial conversations with carer. And as you could probably be well aware yourselves, that, there's a wealth of information that you can tap carers into. And if you did that in your first 2 sessions, they will just be completely overwhelmed and probably wouldn't know where to go to next. So I use this concept of drip feeding. It depends on what they're presenting at that point in time and where they want, what their goals are being set up, and where that information feeding will come into. We do link them into services and make direct referrals. And this is where I have on many occasions, and I continue to make referrals to the Carer Gateway if I see that that is of benefit, that they do need assistance with brokerage, or whether it be to access respite services. I'm familiar with other respite services outside of the Carer Gateway that have carer funding as well. So it's a matter of, together with the carer, I provide them with information of other services, and then that way we work out, well, where will that next referral go to? Where, what will meet your need? Sometimes it is that little bit where if the service is not about the carer, it might be about the care recipient. I do get referrals where the person they're caring for is not linked into My Aged Care. They're just going along, and then you get the community health nurse or the diabetic educator, and they'll turn around and say, well, have you been assessed by My Aged Care? And there's that lot of education and information sharing about, well, what does that actually mean and what's involved? Next slide, Nick. Before I get to that one, I just want to share a little bit more about the My Aged Care concept, where I'm finding that there is a pattern of the referrals that are coming my way, where even if the carer and the care recipient have gone through that My Aged Care process and they receive their support plan, their referral codes, and if direct referrals aren't quite made to providers by the assessor, there's not quite much movement in terms of introducing services to that family or to that caring situation. So I find a lot of my work is helping carers and educating them around the common home support services that are offered through My Aged Care. And another one that's emerging quite strongly is the home care package process, if I could say it that way, where I'm finding a lot of carers say, oh, he's got the package. Oh, great, that's good news. And who's the provider? I'm waiting to hear from someone. There's that, and that's not being naive in any way. I think there's a big gap in where the process of the assessment occurs and an allocation of a package. And there's this waiting period, and then they receive the letters. And okay, the letters are self-explanatory once they're allocated a package, but then there's that concept of, well, how do I find a provider? So I do a little bit of, better word, I wouldn't quite call it hand-holding, but educating and informing them through that process, through monthly appointments. And this will bring me to the slide that's on your screen now. My role is, I describe it as, I know a lot of us do say short to medium term. Nothing is ongoing in terms of the service provision. It is about meeting the care plan. So the goals identified in the carer's care plan with my initial assessment. There's no quite fixed timeline of like 6 sessions, but we work through that care plan and review it as we go along. So for example, if we're coming to the end of that care plan, that episode of care, but the person they're caring for is allocated that carer support, the home care package, and that then becomes an immediate need for that care of, okay, what do we, would you be able to assist me with this process? If the carer feels that they can go along their merry way and do that, not a problem. But if they need a little bit more of assistance, then my care plan will be reviewed and extended to include assisting them through the home care package process and, finding a provider. In terms of how I deliver the service, I'm pretty flexible. I do have clients at the moment. I'm unfortunately working from home. You can probably see the background. But once everything opens up confidently and I'm back at the office, I do appointments at the office, home visits. I'm happy to go to people's homes. Majority of my work, initial assessments are done in people's homes. I'm finding that you gather a lot more information, when you're in their setting, and especially when carers can't leave their home. That's okay. Some carers are happily to meet in the office because they feel like they can't talk, and you probably heard about this through your clients, can't talk freely in front of the person they're caring for. Or sometimes I've even known to meet carers at their local coffee shop because they don't actually get out and about much. And this is more when we've established the working relationship, maybe not at the initial assessments. So when I do my follow-up and my reviews, which could be like anywhere between 4 to 6 week period, they might be done in the coffee shop, and get the carer out and about. My work in regards to the word of, because the previous presenter, Christine for Valid, talked a lot about advocacy. I don't do that type of advocacy naturally. It's a specific specialised area, but I do a lot of what I call about self-advocacy in terms of carers and building their confidence in, negotiating and working with service providers. And it's been interesting during COVID where I haven't been able to do face-to-face, and a lot of my work have been through telehealth, phone calls or emails. And where carers, I've presented them with information or a contact number, and by the time of the next review, they've actually done that piece of work themselves. Whereas previously I found we've sat down together and the phone calls have been made together. So, they're very resourceful and very resilient group of people, carers, as we know as well. In regards to that type of work, in terms of advocacy, if there is a gap that's identified, or maybe a provision of service, during the assessment process might have missed a certain issue, I am known to help advocate on behalf of carers. That does happen a lot with the hospital system. I do get referrals from social workers at Austin Health, mainly, not the other health services in our area, where we find that they realise that carer just needs that little bit more of advocacy with service providers, and I can do that piece of work within a time frame. Next slide, Nick. Are there any questions at the moment? No? Okay. And in regards to, I guess, the referral pathway. So that's just, as I was saying, because it is a Commonwealth Home Support funded program, it is through the My Aged Care that the referrals made to us. It goes to our intake team. They call the carers, and then it's popped onto my waiting list. If the person doesn't need to go through the My Aged Care process, they just call our number at the centre, 9450 2000, and ask to speak to referral and intake. And they will then process that referral and put them on my waiting list and just ask them some general questions. And I think the next slide might be, next slide, Nick. Yeah, Nick. Thank you. Yes, and they're just my details. So that's my email address. And in regards to the number below, 9450 2003, that's my direct number. I have some people say to me, I'm more than happy, can I talk to you before I process a referral? Of course, I'm happy to have people talk to me beforehand to see whether it's appropriate, because sometimes I do find people will say, I'm referring to other carer services. I just want to hear a little bit about your service and where would that carer most benefit, their situation. I do work closely with some staff at Mary Health Fair Carer Services, where we have known to have clients in common, and we'll make sure that we work. We're working coordinatedly in a process where it's easy for the carer. And sometimes I've been known where, I might actually say, look, I'm about to finish up, they can continue through these services as well through the Carer Gateway pathway. Yeah, so that's my role in a bit of a nutshell. Thank you for your time. And I'm open to questions.
Thank you very, very much, Cathy. That was really great. And I think understanding services like yours and some of the others that we've heard in other spotlight sessions who have a more local and community focus are just such a wonderful complement to the services we have. And it's been really great hearing all the things that you can work with people on an individual level on. Can I check my understanding? Would it be, if our team wanted to refer through to you, we had a carer who was in your catchment area, and maybe they'd given you a call directly to sort of talk about this is what the process looks like, would it be appropriate for our team to call your intake and referral team and provide them with the carer's details?
Definitely. So referrals don't come directly to me.
Yep.
If it's actually that you want them to then receive a service through the carer support service at Banyule Community Health, go directly to referral and intake. If your worker just wants to clarify and have a bit of a chat about this is the situation, because as we always say, we don't want to make a referral that's not quite in the best interest of the carer, in terms of, will it meet the need to proceed through to the referral to me? Yes, we can have that conversation, definitely. I do get some calls where they say, well, they're after respite, like, can you book in the respite for them? And they'll need funding assistance. Well, there's those referrals, I'd say you probably need to speak to Carer Gateway and go through that. So that's a pretty black and white one. All the other ones, yes, I'm happy to have the conversation beforehand. I'm well aware of other respite services in the region that I can link carers into as well, that are centre-based or day programs and day respite. Residential respite forms a bit of my work as well, helping carers through that process. So, yeah.
Awesome. Has anyone else got any questions for Cathy? Well, thank you, Cathy, so much.
Thank you for your time.
We'll send around the recording to our list and your slides and contact details as well. As I said at the beginning, we've had a really nice response to the recording versions of these sessions. So it's been a great way to build up an understanding of who else is in our space and who else we can talk to, because none of us can support our clients all on our own. I think all of us can work together to make better outcomes for everybody. So thank you, Cathy, and thank you everyone for watching today's session. We'll have another session in a couple of weeks, and look forward to seeing everyone then.